my name is Sydney Crittenden, and today I'm going to be providing you with some very helpful oral hygiene instructions that are going to assist you in achieving a healthier and cleaner mouth. So let's get started. First, I want to talk about what plaque biofilm is. Plaque biofilm is a sticky film that coats your teeth and contains bacteria. Real quick, if you run your tongue across your teeth and you feel like your teeth are fuzzy, that is plaque biofilm present on your teeth. It is very important that you remove plaque biofilm from your teeth. Brushing your teeth and using interdental aids such as floss are the most universal methods to disrupt biofilm. If biofilm is not removed from your teeth, you are at an increased risk of getting gingivitis, which is an infection of the gums. You may also get inflammatory periodontal disease or cavities. Now let's talk about toothbrushes. When considering what toothbrush is right for you, please be mindful of one that has a comfortable grip, one that is an age-appropriate size, one that has soft bristles, and the choice between a manual toothbrush and an electric toothbrush. A manual toothbrush is a handheld oral hygiene aid that lacks electronic components. A manual brush consists of a handle, a shank, and a head. Most manual brushes are often made of plastic that is lightweight and easy to grasp. Most toothbrushes have nylon filaments. Filaments are just the bristles on the brush head. When used correctly, a manual toothbrush does effectively remove biofilm. I will demonstrate correct brushing techniques shortly, but let's first discuss the power toothbrush. Power toothbrushes are also known as electric toothbrushes. Power toothbrushes move at speeds and motions that cannot be duplicated by manual brushing. Power toothbrushes are highly recommended to patients that have ineffective manual biofilm removal technique. Some indications for a power toothbrush include people who are undergoing orthodontic treatment, aggressive brushers, patients with limited dexterity, patients with disabilities, or people who cannot effectively clean their teeth with a manual toothbrush. Power toothbrushes come in different sizes, such as adult or child, and also have different filament profiles. Lastly, before I demonstrate brushing techniques, I want to discuss general guidelines to follow when brushing and caring for your toothbrushes. It is recommended that people brush their teeth with a soft bristle toothbrush twice a day for 2 minutes. Make sure you are replacing your toothbrush every 2 to 3 months and every time after you're sick. Please make sure your toothbrush is stored in a holder that keeps it upright and never store it in an airtight container. Rinse your toothbrushes after every use with water until it is visibly clean of any food debris or toothpaste. Then allow the toothbrush to thoroughly air dry. It is also recommended that you floss at least once a day and use a toothbrush or a tongue scraper to remove harmful bacteria from your tongue. The tongue is an ideal environment for harmful bacteria, making it super important we don't forget to clean our tongues. You can thoroughly clean your tongue using a toothbrush or a tongue scraper. Cleaning your tongue removes or reduces the white coating, it reduces bacterial load, and reduces the potential of bad breath. Let's switch gears and talk about the importance of flossing. It is necessary that you floss at least once a day to ensure that you are removing plaque biofilm from in between your teeth. There are many different types of floss, such as waxed floss, unwaxed floss, PFTE floss, and tuft floss. I would recommend unwaxed floss to a patient with normally spaced teeth. The wax gives the floss strength and durability. I would recommend unwaxed floss to a patient that has very tight contacts. Unwaxed floss is a thinner floss and may be helpful with contact areas that are super tight. I would recommend tuft dental floss to a patient who needs to floss around braces, implants, or bridges. PFTE floss is a monofilament floss that resists breakage when passed over irregular tooth surfaces such as restorations or a calculus deposit. This type of floss is also linked to numerous adverse health effects. I would refrain from suggesting this type of floss to my patients. Now we're going to dive into some toothbrushing techniques. First up, we have the Bass and Modified Bass technique. The Bass and Modified Bass techniques are considered to be a type of sulcular brushing that is an effective method for dental biofilm removal from underneath the gum lines. This technique is best for people with small gaps between their teeth, exposed root surfaces, and adapting to abutment teeth or implants. A disadvantage of this method is that an aggressive brusher could really do some harm to their gums. I'm now going to demonstrate the Bass technique. You're first going to tilt your toothbrush to a 45-degree angle to ensure that the bristles are pointing to the gum line. You will then move your brush head back and forth over 2 to 3 teeth at a time. You will do short strokes or a circular motion. I will now demonstrate Modified Bass. For Modified Bass, we will use all of the same steps as the Bass technique. We will have the bristles at a 45-degree angle to the teeth, ensuring they are up into the gum line. We will then use short strokes back and forth, but in the Modified Bass technique, we're going to add a sweeping motion down the crown. So we will brush over 2 to 3 teeth at a time and add a sweeping motion. Next, we have the Stillman and Modified Stillman techniques. The Stillman method is designed for massage and stimulation of the gums. The Modified Stillman adds a rolling technique to clean the crown of the tooth. These methods would be recommended to patients who need a general application for cleaning tooth surfaces and a massage of the gingiva. Light pressure is needed with this method. So a disadvantage could again be that a person may cause tissue lacerations to their gums if not performing this method correctly. The Stillman method of brushing is very similar to the Bass technique. We are still going to angle our toothbrush at a 45-degree angle. However, we are going to place our bristles more onto the gum line than in the Bass technique. We are still going to do short circular motions over 2 to 3 teeth at a time, or a horizontal back and forth motion, just like so. I will now demonstrate the Modified Stillman technique. The Modified Stillman technique is the same steps as the Stillman, but you will add a rolling stroke to finish the technique. We will still angle our toothbrush at a 45-degree angle onto the gums. We will go back and forth in a horizontal motion over 2 to 3 teeth or a circular motion over 2 to 3 teeth. We will then add a rolling sweep when we finish. Another method of brushing is the Phones method. The Phones brushing technique is recommended for children to use as it is easy to learn. A disadvantage of this method may include missed areas of plaque since a child is performing the technique. I will now be demonstrating the Phones method. Place the toothbrush at a 90-degree angle to the tooth and press gently against the tooth. The bristles are moved in a circular motion several times. Make sure that you brush 2 to 3 teeth at a time and then move forward. I also want to note that if you are brushing the backs of your front teeth, it is important that you place the toothbrush vertical to the tooth and brush like so. Next, we are going to talk about the Charters brushing technique. Charters brushing method is especially helpful for people who are undergoing orthodontic treatment. Since the brush is angled away from the gums, it is going to aid ortho patients in removing plaque biofilm from around the brackets on their teeth. A disadvantage may be that plaque biofilm is missed under the gum line. I will now demonstrate the Charters brushing method. The brush is going to be angled at a 45-degree angle to the chewing surface of the tooth. This is opposite of the Bass technique. Use a small amount of pressure and make 3 to 4 small rotary movements with the bristles. We will brush over 2 to 3 teeth at a time and move forward. Now we will talk about occlusal brushing. Occlusal brushing is a supplemental brushing method that helps to remove food and biofilm from the pits and fissures of our teeth. Pits and fissures are the deep grooves you see on the chewing surface of your back teeth. I will now demonstrate occlusal brushing. We will place the bristles of our toothbrush down into the chewing surface of the teeth and vibrate the brush in a slightly circular motion and count to 10. I would recommend doing this over 2 teeth at a time. Once you count to 10, you can then move forward. This method is the same in all areas of the mouth. The last 2 methods of brushing I'm going to discuss include brushing with an end-tuft brush and a power toothbrush. First, I will speak about the end-tuft brush. End-tuft brushes are designed for specific maintenance concerns such as difficult to reach areas like the backs of your last molar or people who need to clean in between their teeth better for various reasons. With improper use of an end-tuft brush, people can damage their marginal gum tissue. I will now demonstrate using an end-tuft brush. Place the brush in between your teeth and rotate the brush in about 6 circular motions, and then you will roll the brush up or down. You will continue to do this between each tooth. You then can come to your last molar and do the same thing. The small head of the end-tuft brush makes it easy to get to the very backs of your teeth. Now, let's talk about the power toothbrush. I will now demonstrate how to use a power toothbrush. When it comes to using a power toothbrush, you want to hold your brush at a 45-degree angle towards the gum line and press the start button. Be sure to let the brush do the work. Slowly move the brush head from tooth to tooth, ensuring that you aren't missing any tooth surfaces. To wrap up this oral hygiene video, I'm going to end by educating you on how to properly clean your tongue and how to properly floss. I will now demonstrate how to properly clean the tongue. Hold the brush at a 90-degree angle to the tongue with light pressure. Draw the brush forward and over the tip of the tongue and move in a circular motion 3 to 4 times. I'm now going to demonstrate how to floss. First, you want to start off with 12 to 15 inches of floss. You're going to wrap the floss around your middle finger. You want to allow only a ½ inch of space in between your thumb and index fingers. You are going to hold the floss with your thumb and index fingers. We are then going to slowly work the floss in between the teeth. You then want to curve the floss around the tooth in a C shape, like so. Press the floss against the tooth and gently slide the floss up and down, ensuring that you are going below the gum line. You then want to rotate the floss in between each tooth to make sure you are not spreading bacteria from one area to another. I'm now going to demonstrate how to correctly floss with a floss holder. You will put it in between the teeth and gently slide the floss through the contact. You will then pull the floss against the tooth to create as much of a C shape as possible. Ensuring you're going below the gum line, slide the floss up and down. You will then pull the floss backwards and slide up and down below the gum line on this tooth as well. Thank you so much for taking the time to educate yourself by watching my oral hygiene video. I hope that you learned something that you can implement into your everyday oral hygiene routine. Bye!